I think the concept of biological medicine is very much similar to the homeopathy. Because in some of your interviews, you said we treat patient as a whole, not based on diagnosis. So, can you tell me how biological medicines is different from allopathy, homeopathy, and Ayurveda? So, is there any relationship between biological medicines and homeopathic medicines? I have a doubt here. So, at any time of your life, were you afraid anytime to promote this biological medicine, or any main challenge that come into your life while promoting the biological medicine? Is there any scenario in your past? If our viewer is suffering from any acute or chronic disease, how he can test that his body is going down or is not able to improve his immunity or anything else like that? So, Dr. Thomas, I came to know that you have invented a biological medicine and you are very much promoting the biological medicine at a global level. So, can you tell our audience what is biological medicine basically?
I know this sounds very arrogant when I say we find the causes of the patient's disease. Why is we call it regulation? Why does the body not maintain health by itself? There are always causes, and we go into the diagnostic of the causes.
Hello everyone, I'm Varun Kukreja. Welcome you to our Bharat Homeopathy YouTube channel. Today I have brought an interesting episode on biological medicine and holistic healthcare. Today Dr. Thomas Rao is joining us, who is a leading expert and inventor of biological medicine and holistic healthcare. He is also the author of Swiss Secret to Optimal Health. So welcome Dr. Thomas Rao, how are you?
Thank you very much. Thank you very much that I can come here and to talk to the Indian and international healthcare interested population.
Right.
Yeah.
So, Dr. Thomas, I came to know that you have invented a biological medicine and you are very much promoting the biological medicine at a global level. So, can you tell our audience what is biological medicine basically?
This is a basis of medicine which works extremely well. It's not an invention, it was a development over 30 years, and we integrate new techniques all the time. So it really changes the body's cell, the body cell by cell. We always say we renew the body cell by cell.
Right.
This takes quite a while, and it goes to the basis of the cause of disease. Right. We say we don't treat diagnosis, we treat human beings.
Okay. So, I think the concept of biological medicine is very much similar to the homeopathy. Because in some of your interviews, you said we treat patient as a whole, not based on diagnosis. So, can you tell me how biological medicines is different from allopathy, homeopathy, and Ayurveda?
Yeah, that's a very good question. You know, all what you just said, allopathy sometimes even works, but homeopathy works on millions of patients. So, but in fact, it is always about the same system, human being.
Right.
What is so different in India from European people? It's not really much difference. They have the same metabolic pathways. And so we tried, I always said it needs a dictionary of these medicines. So what are they doing differently in Ayurvedic than in homeopathy or in traditional German medicine, right, or in even in Chinese medicine? They, in a way, they do the same thing, but they have different techniques, different expressions. So we just need the dictionary, so to say, to integrate. And the difference is allopathic medicine has a totally different approach because they are working against symptoms and not for the human being. This is the big difference.
Okay. So you can say, you are saying they are doing any alternative of symptoms. Like they are, because in India, we normally say allopathic medicines are not so much successful because they don't treat the disease by the cure, from the root of the disease, right? Mm-hmm.
I know this sounds very arrogant when I say we find the causes of the patient's disease. Why is we call it regulation? Why does the body not maintain health by itself? There are always causes, and we go into the diagnostic of the causes.
Okay, okay. So, is there any relationship between biological medicines and homeopathic medicines? I have a doubt here.
You don't need to have a doubt. Homeopathy is a resonance treatment. You give a globulus, a little globally,
Yeah.
because you found where is the real constitutional deficiency
Exactly,
of the
sir,
patient.
exactly.
And the same we do also, but we work on a lower level. We change the metabolic constitutional level, and homeopathy works so extremely well when the patient, first of all, has the reactivity.
Right.
You give a globulus and then they react. But if the patients nowadays, they have no more energy, they are toxically low, and they are metabolically a wreck, so to say, and they don't have the energy anymore to
Yeah.
do this, to take this impulse. And for them, we build up the basis of health so that they react again.
Right.
Yeah.
This is very interesting, Dr. Thomas Rao. I just want to, a little bit, this idea is coming to my mind. How do you, in which scenario you think that you should invent biological medicine, or when it was started in your mind?
You know, I am a orthodox doctor.
Yeah.
I'm a specialist for internal medicine
Right.
and rheumatology. That's what I learned. And I had a practice 40 years ago, and I had a lot of rheumatoid patients, rheumatoid arthritis patients, psoriasis patients, lupus patients, even multiple sclerosis. And honestly, they did not really get better.
Okay.
And I had them for years, and then sooner or later, they came and said, Dr. Rao, now I'm so much better. Well, then I was one of these rare doctors who really ask, well, what did you do? You know,
Yeah.
normally they don't get asked, what did you do? And they say, oh, I changed my diet. Oh, I did alkaline treatment. You know, I was what? You were hyperacid, and so on. This was fully new to me as a orthodox doctor. And I began to integrate, and my patients got better. I began to integrate nutritional factors to more or less all the patients, or I did deacify them because they are hyperacid, or I began to give trace elements and minerals because they were in a lack. And more we developed this, and now I have absolutely sophisticated techniques to measure. You have this lack. For example, the diabetes patients, they no more have the enough chromium, and chromium has to be added, and then the metabolism works again, and so on. This is only one little example, but we have the diagnostics and we have the super specific treatments now, and we simply, sorry, dear patients, it sounds very arrogant, we simply no more need allopathic medicine because we build the basis on the patients and they no more have the symptoms, and then they don't need the allopathic remedies anymore.
That is very good news for all your audience, all our audience, that after taking biological medicine, you don't need any allopathic medication to cure your disease or to suppress the symptoms of your problem, right? So there is a question,
I
Dr.
would not
Thomas.
say it 100%, perhaps 95%.
95%, and you are confident about 95%.
It depends from what disease. Of course, my patients, I have a lot of cancer patients. The patients who come to me after 40 years, they are really the very difficult sick ones. So I don't get the little flus and so, or the nose sneezing. Such things we don't get. But we get the real difficult patients, and they were not helped by orthodox medicine, by allopathic medicine. But now, when we integrate our biological, which is a multi-level, multi-modular treatment, I
Right.
integrate Ayurveda. I know very much about Chinese medicine. I know that, well, I'm a trained homeopath. I really know about this. So we just put this together and
Okay.
super individualized. If you have a rheumatoid arthritis, let's say, and the other one has also the same disease diagnosis, then you get totally differently treated. We treat human beings and not diagnoses.
Yeah, that is a very good motto of yours, that you treat the disease. Because even in our Bharat Homeopathy, our main tagline is this only, that we don't treat the disease. We treat the patient who has the disease, because every patient is different. From body to body, there are multiple changes. There are multiple things changes, like someone is suitable to any other remedy, some is suitable to any other remedy. So we always focus to treat the patient who has the disease. So at any time of your life, were you afraid anytime to promote this biological medicine, or any main challenge that come into your life while promoting the biological medicine? Is there any scenario in your past life?
Honestly, ethically, I would be in fear to continue to use allopathic medicine, because it only suppresses the human being's
Right.
metabolism. No, it's all opposite. I'm proud to do this medicine which is for the patient's body.
Okay.
We do for treatment and not against treatment.
Yeah, for the treatment.
That's like the homeopathy. You do this analysis, you make the questions, hundreds of questions, and then at the end you say, oops, this is this constitution, you tend to this and this, and then you give the globally, because you hit it so well. And biological medicine does this also, but not on this super specified level, because many patients, they have mixed constitutions.
Right,
That's the
right,
real
right,
problem
right.
nowadays.
Right. So there is a myth that our body can cure itself on its own. Do you agree with this myth?
Absolutely, otherwise you wouldn't have, you couldn't live. There is always influences. Look at the little child. The little child gets, the healthy child, if they still exist, they get the virus. And the body notices, oops, a virus comes. And the immune system works accordingly.
Yeah.
So, and it brings the child back to normal metabolic living. So this is the self-healing. But our patients, the older they get, the more they get wrong nutrition or toxic load or electromagnetic load, they have more and more, they can't do this self-regulation. We call it the regulation of the body to come back to health. They lose this capacity.
Okay. In which scenarios they lose that capacity? We can expect, because if a patient, if our viewer is suffering from any acute or chronic disease, how he can test that his body is going down or is not able to improve his immunity or anything else like that?
We have very differentiated, very detailed diagnostic techniques. Europe is really strong on this. And so I examined more than 1,000 patients. Very specifically, they came in our clinic, I examined, and what I found is they came for multiple sclerosis, they came for cancer, they came for whatever, or lung fibrosis gets so frequent. And I tested them, and I found, now this is extremely important, nowadays patients, they are sick for toxic load. They have heavy metals, they have organic toxins from the nutrition, they have all these preservatives in the food when they go to buy convenient food and so on. They get all these stabilizers, colorants, and that's all toxic things, or heavy metals from the teas and so on. And this is number one. Number two is in more than 90% of our patients who come across with some difficult diagnosis, we find an intestinal health additional problem.
Right.
The microbiome is disturbed because they get antibiotics, they get, well, these preservatives, which are preservative ingredients in the food, which destroys the intestinal system. And the intestinal system is the site of life,
Right.
of life
because
energy.
Life energy.
Yeah.
Because.
So we have to build up. And only by doing, I not even touch their disease, I build up the intestines, I detoxify, and after several weeks, they begin to become much, much better.
Right. So one more question is coming in my mind. Like if our body is, how our body is improving ourselves on its own or helping in us in fighting with the disease on our own. So there is an equal role of diet, I think. What we intake is what we get. So do you think excessive use of sugar is the biggest enemy of any human being?
I faint. Yes, the answer is clearly yes. Patients, now not only patients, the population is over-sugared. They take too much sugar, and the sugar intake since 1980, 45 years, increased by factor 10. You can't believe it. It is, well, at least in the Western world, it increased dramatically. So you have a permanent overload of the pancreas. You have a permanent overload on the sugar. And you have so much fermentation that you get hyperacid and you destroy your small the arteries and the capillaries. And then you get coronary heart disease, you get heart infarction, and so on. It's all secondary to the long-term wrong nutrition. And that's why I tell the patients, you are the healing doctor. Yourself, you just have to know what to do, and you have to do it. This is the important thing. But I can tell them super specifically what they have to change and which kind of medication. We build up the basis of health.
Yeah.
I'm also a homeopath, and I realize now, since we do this, the homeopathic globally, they work much better. Now my patients, they react again, honestly. Oh, I'm not even really allowed to say this, but homeopathy in the nowadays world works less because the patients are so blocked, they can't process the stimulus anymore. And this changes when they change the inner milieu. We always talk about the inner, this means the metabolic milieu of your cell.
Yeah. Normally we always talk about this only. Yeah, exactly. So like we do here at Bharat Homeopathy, we treat several chronic diseases like kidney, brain disorders, liver disorders and everything. So according to you, Dr. Thomas, is biological medicine can treat severe chronic conditions at once, or we have to go for individually? Like we have to, if the patient is having brain disorder along with the respiratory disorders. So how we can deal with the patient and how the biological medicine is helpful to for the patient?
Unfortunately, patients come too very late to us.
Yeah, mainly.
This is really a problem. So they come with dementia or beginning, they begin to realize, oh, I have dementia, Alzheimer's.
Right.
And then hopefully they come, I tell, come yesterday, not today. Begin yesterday.
Yeah.
But, and then, of course, brain change. The brain cellular change is a long process.
Yeah.
It takes several months until it really works.
Yeah,
That's
obviously.
the patients have to know. A liver renews itself in 6 months. So a liver cirrhosis or fatty liver, we can change in several months.
Yes.
But if you do not do the change in your metabolism, it won't change.
Exactly, sir.
Yeah, but I have patients they came with fatty liver or liver cirrhosis, even after virus, hepatitis B. They came with GPT, with liver values 500 up to 1,000 50 would be the limit of normal. So, and they come within several months, they come back.
Now you have pointed a very important point. Maximum number of patients don't come to us in their early stages. Maximum, because in Bharat Homeopathy, we are treating more than 1,000 patients on daily basis. We are also experiencing this thing, and we are also seeing this thing in if I talk about the kidney patient. Maximum number of patients are on stage 5, stage 4, or end stage kidney failure. In liver fibrosis, we also see like this thing, and in the brain, like paralysis and Parkinson problem. When they have tried everywhere and they are just thinking like, yes, now I'm in the last stage and I just tried this homeopathy or any other pathy. So what your experience says ki how should the patient react in their early stages?
It's so sad. I get these phone calls all the time. Oh, Dr. Rao, can you still do something?
Yeah, that still is the issue. Yeah.
Exactly. The still question. And they come progressed. I can't renew your brain in a month. This is not possible. But if you really change, even Alzheimer's, they stabilize, and I have many patients that got not healed, but significantly better, or at least a little better, but not downhill development.
Exactly.
And the same is with kidney disease or lung fibrosis. We have so many lung fibrosis patients.
Okay.
You know, the OCPD, the COD, you know, the lung deficiency. We have so many patients. If they take our diet and the Sanum remedies, which we just talked before privately, if they take them, they get better over several months. But what would they have if they would not do this? They would go downhill.
Right.
And we get these downhill patients, they come to us, and then somehow. We have international patients. International patients, they come with the planes. We looked at them, the ones who come from the US, from Brazil, from Russia, from wherever, 80% of them, they come back. And they come again and again. So if it wouldn't be, they wouldn't come again. So we have the repeating patients, they are nearly, they are more than 80%.
More than
even
80%.
From international.
Even from international.
Yes.
Right, this is a very good figure.
Yeah.
I think, Dr.
And we
Thomas.
have thousands of patients.
So, among them thousands of patients, can you tell our audience some of your clinical case studies where you found that biological medicine has greatly improved the conditions or the lifestyle of the patient? Some of your clinical case studies, some of the experiences.
Diagnosis where I can nearly say, nearly guarantee that they get better is ulcerative colitis or Crohn's disease, rheumatoid arthritis, even multiple sclerosis. They get, most of them, significantly better. I never say, I heal you. Multiple sclerosis depends, but we have many in wheelchair who walk again.
Okay.
Yes, but not only, of course, but many.
Right.
And nearly all of them who came, they were in a bad situation. Otherwise, they wouldn't come to us, to Switzerland.
This is amazing, Dr. Thomas.
That's really amazing. Yeah. And then other diseases, you know, the intestinal diseases. Irritable bowel is super easy. Please come to us with irritable bowel. I really like this. Yeah. Because they have long histories. They are not taken serious. They go to the so-called specialists, and then the specialists, they say, oh, we didn't find anything, it's only psychiatry. Yeah, go to the psychiatrist. But they looked wrongly. They did not even look at the intestinal milieu and the intestinal flora. The microbiome doesn't exist for the specialists. It's in some way. And you rebuild this, and then it goes much better.
So some of the case study of any patient selectively that when the patient comes to you, the case taking was this, and from time to time you have seen the recovery. Any one case study you want to share with our audience?
I have hundreds of
Any one patient that you have seen a very good recovery from time to time, you can discuss.
A typical case.
Yeah.
Typical case is ulcerative colitis.
Okay.
And these are about 80% are ladies.
Okay.
So in the mid ages. So I have this lady, and she comes, and she is told, we did Imurec, we did all these immune suppressants, we did cortisone, and so on, and probably you need, and she still had colitis, diarrhea, blood in the stool, and so on, pain.
Okay.
And she was told, yeah, you should remove your colon, we have to operate.
Right.
Take the colon away because it's diseased. But the colon is an important organ.
Bilkul.
And I asked her, well, what did you do as diet? Oh, I was told you can eat everything. This is crazy.
This is
so
really crazy.
we change, number one, we changed the nutritional approach,
Yeah.
individualized. Then, well, because we found she is allergic, for example, to gluten.
Right.
This other lady, she was to cow dairy milk and products.
Right.
So she had to change, but she was not told by the so-called specialists. I call them so-called because if they would really be knowing everything about the disease,
Yeah.
they would also have to know about diet.
the diet.
Yeah.
Right.
So, I know it's cynic, but then we did our treatment to build up the intestinal mucous membranes because we can test them even in the small intestine where you can't do endoscopy.
Okay.
In the small intestine. So we can even test this.
Okay.
And we can see the inflammation. So that's what we did. And this was about 25 years ago. She still comes to me, perhaps every year, or she says, oh, I was no more really keeping to the diet and to what you say, and now it begins to come again. You know, you have a constitution also. And this lady must know that she can't do everything.
Okay, this is amazing, Dr. Thomas. This is amazing. So basically, we have also seen in the Bharat Homeopathy experiences, myself also have seen that so-called, the word you use, so-called the specialist doctors are unable to consult the patient about the diet. Whenever we were treating respiratory, basically on the respiratory patients also, we have seen they are taking all the diet extremely wrongly. And they have taken treatment from the best to best organization in their states, in their countries. Like, yes, we have took the treatment from that specialist doctor, we have taken to that specialist doctor. But whenever we comes to their diet taking, what they are eating in the morning and afternoon, we completely, respiratory patient is taking dairy products on daily basis. So please tell me how he can be cured. While taking, do you think respiratory patients should include dairy products in their diet?
No, respiratory patients should avoid dairy products.
Yeah, exactly.
But nearly, not 100. We have very good research in this, exactly in this topic. And in the Middle Europe, where I am, Switzerland, Germany, France, and so, about 60% of the whole population is reacting to cow dairy product. Beta-lactoglobulin is a very high frequency allergen.
Okay.
And if they have the pulmonary aspergillic tuberculinic constitution, then they get the disease. But the basis is the inflammatory, the basic, it's called silent inflammation, which comes from wrong nutrition. And this silent inflammation makes the basis, and then they have something else, and then they get the pulmonary disease.
Right. So somehow, Dr. Thomas, a question arises in our audience's mind, our audience patient's mind. Somehow we normally see a normal question, a selective question from our patient's mind. Can you tell the efficiency of the biological medicine in chronic conditions or in colitis and respiratory conditions, and how much time it will take to relieve the condition of the patient?
What the patients don't like is when I tell them, you have to do this and it will take several months.
Okay.
Because in some diseases, intestinal, they feel within 2 weeks, 3 weeks, they feel a significant change.
Right.
But in lung is a slow reacting, slow renewing organ. It takes several months. But the success rate with our biological medicine in this chronic disease is at least 80%.
Okay.
Yeah. But of course, it depends in which states you are, in which disease you are, because from disease to disease and from body to body, it's the reactivity, the rebuilding goes longer or less.
Okay. Dr. Thomas, I found one thing in common while discussing with you, that your biological medicine is somewhere related to holistic healthcare, right? And a healthy diet and active lifestyle is doing very good along with the biological medicine. So, my question is, if the patient is not suffering from any disease, so will you advise something on the diet chapter, that he should be not taking anything excess in his diet, regular diet, or not a shortage of this in diet? Please shed some light on the diet for a normal human being, that he could be saved from any acute or chronic diseases as how much as he can.
You can be more or less protected from developing chronic diseases if you approach your body but it's individualized with a good nutrition, because nutrition and what you drink determines your body. This is so important. And if you nutrify yourself, and if you do also what you drink is extremely important, then you can avoid, if you are still healthy, you can avoid development of diseases. Or if you get something like a virus or whatever, then you can overcome it much, much better. So, no question. We tell the patient, but this is in Middle Europe, where all the patients are somehow toxically loaded.
Right.
Make a regular detoxification with some supplements which we give, which can be NaC, which can be selenium, which can be zinc, which can be zeolite, all these kind of things, or do some detoxification techniques, drink a lot, but no sugar-containing drinks. This is so important.
Okay, this is very important. No sugar-containing drinks.
Exactly. Right. Yes, all the Pepsi and the Sprite and whatever, ginger ale and all these kind
the
of...
chili cold drinks that are available around us, right?
I did not mention Coca-Cola, but there are also this kind of group of drinks you should not take. This is number one. Secondly, mainly warm things to drink, because you have to increase your metabolism.
Okay.
There is, in India, the little children, they chew ice cubes.
Yeah.
This is so really not good, because first of all, you do ice cubes from tap water. Normally, most patients, they do this. They make the ice cubes from tap water. Tap water contains chlorine.
Okay.
And chlorine and other things which are highly toxic.
Okay.
And they
suppress,
so they ingest themselves all the time with this toxic chlorine, which blocks the organism. Then in nutrition, but this is Middle European, we tell the patients, reduce animal protein. So meat, little. I don't say you need to be vegan. I'm not, not so religious about this. But eat less meat and much less dairy, cow dairy products. Okay. Because our Middle European population takes the intake of protein is more than 85% comes from meat.
Yeah,
and
obviously.
and from dairy products.
That's why I'm also shocked. I want to very interestingly know, why should we not eat meat products? Why should we not be dependent on the meat products?
Because meat allows bacteria to upgrade faster.
In our body.
In our body, this is one. And meat is highly containing protein, but also fat.
Fat.
But the bad thing, the dangerous thing is the over-proteinization.
Yeah.
Middle Europe, well, I speak about Western world. Western people, they eat much too much protein. They can't process.
Yes.
Then the rest which is not processed, so to say, glues into your body.
Yes.
And makes the whole metabolism decrease.
And this also damages the kidney as well, right, sir?
This damages kidney disease is an over-proteinization disease. It's no
Right,
question.
right.
But 20 years long.
But 20 years long.
Yeah.
On an average, it took 20 years to excessive use of protein to damage the kidneys.
It's different if you get additional infections and so then it goes much quicker. But it's nearly always it's a hyperproteinization disease. This is why even the specialists, the nephrologists, they say reduce your protein intake.
Right.
Because it glues to the kidney.
But I have heard whenever kidney patient goes to the allopathic doctor or is on dialysis, they normally suggest you should take high protein diet. My patients was telling me.
Then you have the wrong doctor. No, this is super unscientific.
Normally, I think allopathic doctors suggest them.
Yes, but then I don't want to. I'm not a polarizing person. I don't want to say negative things, but this is just scientifically not proven. This is not true.
Okay. So I think our gut is something that is majorly decides our immune response to our diseases, right? So what is your take on how our gut regulates our immunity? How our gut manages our immunity and why gut is very important to fight with any disease?
The gut,
the
intestine. Yes. The biggest organ by far which we have in the body is the intestinal mucous membrane system. The gut is the biggest organ by far.
Okay.
And it has a surface of, nobody really knows exactly, but between 1,000 and 3,000 square meters. Big like a football field. Our intestinal system.
Right.
And it renews in 3 weeks. These intestinal membranes, they renew. Imagine this rebuilding, this metabolic force. It's fantastic. Life is in the intestines.
Yeah.
And we want our patients have more life forces. It's a very homeopathic, very Ayurvedic.
Exactly.
Very Ayurvedic thinking. So we want the life force to be like in a child, you know, this regenerative energy.
Yes.
But this comes from the gut. And along the small intestinal system, 80% of our lymph cells, the T cells, the immune cells, they are in the so-called Peyer's patches. Along the along the lining of the intestines, we have 80% of our immune soldiers, so to say.
Exactly.
You know, the army of the immune system lays in the small intestines, and we permanently disturb it. We permanently destroy it.
Yes.
Who wonders that on the other side you can't work against bacteria or viruses anymore?
Yeah.
My patients, I build up the intestinal system in all the patients. We test in the beginning, then we build up whatever they have, and they no more get viral diseases.
Okay.
It's interesting.
Interesting. Okay, Dr. Thomas. At Bharat Homeopathy, we also prescribe specially customized diet chart along with our medications for our kidney patients. I would like to know what sort of diet you recommend to kidney patient, as millions of people are living with the kidney disease worldwide. First, you have all suggested us that limit the intake of protein. because excessive protein is the major cause of the kidney patient. What else the kidney patient should determine or be careful about the diet?
We say it would be ideal to have a plant-based nutrition. I like this expression better than vegetarian. Vegetarian sounds so religious, you know.
Exactly.
People don't like this. So plant-based, little meat with little salt,
Yeah.
but Himalayan salt is allowed.
Okay.
Himalayan salt
Okay.
because it contains all the trace elements. White salt does not contain the trace elements.
Yeah.
So, and no dairy products because the dairy directly glues into the kidney.
Should a kidney patient also avoid consuming sugar or refined sugar?
Yes.
Yes.
Yes, because long-term intake of too much sugar, and everybody takes too much nowadays, makes
Okay.
more inflammation. Silent inflammation is the basis of the kidney diseases.
While talking about sugar and salt, I have seen many skin patients, especially the psoriasis ones, that when they consume sugar and salt, their psoriasis aggravates.
Yes, absolutely.
So how can some food triggers the disease? I just want to know about it. How a small amount of sugar or salt can trigger the disease to its worst.
The body is super smart, and the body notices that if you have toxins in your body, sugar in over quantity is toxic, is damaging, makes a hyperacidity, and the body tries to eliminate, but the kidney is no more strong enough, and the liver is anyhow, because they drink too much and they do a wrong diet, the liver is any much overloaded, so the body takes the skin to eliminate. You sweat, you know?
Yeah.
The sweat is
Yeah.
also a elimination.
Okay.
And then they begin to excrete through the skin toxic things that the skin reacts with psoriasis.
I have a question. Dairy products and gluten are restricted in many diet regimes. What other food items would you suggest to fulfill nutritional deficiency if we cut dairy products and gluten?
That's a very difficult question. There are very good studies in Europe, at least, and also in
Yeah.
USA, so which shows that 60% are intolerant to beta lactoglobulin, which is the cow milk
Yeah.
protein. But 20% are allergic to gluten, which is
Okay.
from the wheat, you know, the wheat protein,
Yeah.
the gluten in the wheat and in other cereals. There is
Okay.
gluten. And so that's why many strict diet suggestions, they say you should avoid dairy products and gluten products.
Okay.
Because then you catch more than 90% of the food intolerances.
Okay, nice. Okay, this is amazing. Dr. Thomas, in case of autoimmune diseases, what would be your diet suggestion? Because autoimmune disease is a very, you can say, neither it comes in chronic, neither it's come in acute. Because sometimes simply skin problem is also autoimmune disorder. Multiple skin problems are there. So what kind of diet you suggest to those patients?
The same what I said, alkaline diet.
Alkaline
You
diet.
can go to the biological, you know, the libraries, health libraries, and they will tell you what is alkaline diet. But again, honestly, it is always the same thing. All these alkaline diet, they say little sugar, little meat, and little cow milk products.
Little cow milk product.
You
Doctor,
still have, what should I eat then? They ask the patients. You still have so much. All the vegetables, many cereals, rice, and so on.
I hope everyone get the answers of their questions about their diet, right? So, Dr. Thomas, I have one more question related to brain health. Today, I see with several neurological disorders, even in Bharat Homeopathy, we treat patients with brain disorders like the patients of paralysis and Parkinson. But I think diet somehow has a significant role in the recovery or enhancing brain functions. If I talk about antioxidant and inflammatory foods, what foods would you suggest to people with brain disorders according to your knowledge?
We have a lot of stroke patients,
Yeah,
or we have a lot of Alzheimer
for those patients only.
development.
Yeah.
For them, we begin with a 3-week strict vegan food. Not
Yeah.
because I'm religious about vegan. No, absolutely not.
Okay.
But the vegan food is anti-inflammatory.
Yeah.
And then slowly we can integrate other products like cereals, like a little chicken meat or fish, these kind of things. But these neurological patients, they always have a lack of phosphatidylcholine, phosphatidylserine, all these very, very high quality fat substance, because the brain cells and the nerve cells, they contain about 60, even up to 90% of fat molecules.
Fat molecules.
And you have to have good fats and not bad fats from meat. And
Okay.
meat you have to fry or whatever that you do, you make the fat molecules even worse.
Okay, that is very good knowledge that has given with by you. Well, that's really great. So you have explained everything in detail. But before we wrap up, what's your final you can say reference for the biological medicine that every patient needs to know about the medication? About the biological medication, like somehow if he wants to take biological medicines from Bharat Homeopathy or by visiting in your OPD or anywhere else, what is the basic knowledge the patient have? You think the patient should have about the biological medicines? Is that a sympathetic way that basically is understandable by the patients? Ki yes, I am taking biological medicines. This medicine is composition of this or this pathy or this type, and they don't have any side effect. And it's a trust issue for the patient. But sometimes, yes, I am taking the right pathy, right remedy, and I can get good results after waiting for 1 month or 2 months, or after taking regularly medications for 2 to 3 months.
The side effect of my medication is that the patient feels much better. No, I know this sounds a little bit drastic, but there is not a rule. The rules are you can change your metabolism, your body, with a change of diet, which we can tell you how and individualized. Secondly, when you come with a progressed disease or a difficult disease, most of the patients have a toxic load, we have to detoxify, and most of the patients have a lack of good trace elements and amino acids. And we give you products which build this up. So you begin from day one to rebuild your cell by cell. So that's it. I never tell the patients, oh, stop all the orthodox, the allopathic medicine. No, we can make a shift. You can decrease the allopathic medicines under the control of Dr. So-and-so, biological doctor, and we give the medication which rebuilds the system.
Okay,
it's normally a process of several months.
Right. That's inspiring, Dr. Thomas. Today's episode was about biological medicine, holistic healthcare, and lifestyle experiences. Thank you so much, Dr. Thomas, for visiting Bharat Homeopathy. I personally believe your biological medicines will be very great for the holistic care of each and every patient. I hope we will meet once again and we'll do a podcast again.
Thank you very much. Thank you. I hope we have a lot patients looking, especially if they have difficult diseases. There is always hope. It's never too late. This is so important to know. And you are the healer doctor.
Very kind words, Dr. Thomas. Thank you so much. Thank you so much.